Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, Stephanie Desmon talks to Johns Hopkins epidemiologist Dr. Caitlin Rivers about her new book, Crisis Averted: The Hidden Science of Fighting Outbreaks. Rivers shares lessons learned not just from the COVID-19 pandemic, but outbreaks throughout history, and considers what we need to think about moving forward. Let's listen.
Caitlin Rivers, thanks so much for joining me.
Thank you. It's great to be back on the pod.
So I wanted to talk today about your new book. So very exciting. You've just published a new book, Crisis Averted: The Hidden Science of Fighting Outbreaks. And I want to start real basic. Tell us about the book and why you wrote it.
Thanks. Yeah, my book just came out. It's published by Viking, available at bookstores near you. And it's about the hidden science of fighting outbreaks. It looks at some of the most gripping, the most mysterious, the most exciting outbreaks in the history of public health, and really dives deep to look at the people who chased those outbreaks and brought them under control and how they did it. One thing I'm proud of in the book, too, is it really elevates the characters, the heroes of those public health stories. And this was important to me because I really wanted the audience to see public health more and better understand that behind every amazing win and success story and even stumble, there are real humans doing amazing work. So it was important to me to lift those heroes up.
Mm-hmm. And what do you want people to take away from that?
I really want people to better understand the hidden nature of public health. It's one of the least appreciated forces, I think, in modern society, but it really has changed the course of history. So I would love readers to better understand that, and also to better understand the forces that push and pull on public health. For example, I write in the book about the cycle of panic and neglect, which describes how after every major outbreak, epidemic, pandemic, there's a big surge of interest, funding, support to really get public health the resources that it needs to do its best work. But those investments work. They are successful in preventing new crises. And that quiet that emerges from those investments wears on awareness and makes people less and less likely to continue those investments, because why should you if everything's going great? But of course, over time, as those investments erode, the threat resurges and we are back in the panic part of the cycle. And so illuminating those kinds of forces, I hope, will help readers better understand some of the patterns that we see over the life cycle of public health.
What would you say is the biggest message that COVID has taught us?
So many. It was one of the most consequential events, I think, in public health history, but one lesson that I saw a lot of in COVID-19 that I continue to see as new events roll off the line is around communication and the importance of truth-telling. I think that the trust the public had in public health officials and the public health enterprise was so important for determining how individuals experience the pandemic and also how we as a society experience the pandemic. And what I saw is that across several points in the pandemic, there was a reluctance by public health officials to tell the full and honest truth. For example, in the early days of the pandemic, there were a lot of reassurances that the risk to the American public was low. And it was not low, and it quickly became apparent to everyone that the threat was quite serious and quickly emerging on our shores. And so that's one example where I think the impulse to reassure really may have started to erode the trust between the American people and public health officials. I think another example is in the early days, again, of the pandemic, the recommendation was against wearing masks. Not only did you not need a mask, so the story went, but it was actually worse to wear one. We heard that because people might touch their face or they might choose the wrong mask, and somehow that would be worse. And the real story behind the story there was not that masking has no benefit, but that the masks were really needed for healthcare workers. And so there was kind of a latent variable. There was something in the message that wasn't being clearly communicated. that ended up, I think, really confusing and burning people a little bit for the unclear messaging. And so I think communication has really emerged for me as one of the most important priorities in how we move forward in public health.
Right now, we're in a place where this trust is still been eroded and it has not come back. And I'm wondering how public health can gain that trust back.
Two things come to mind for me. One is continuing the commitment to frequent, clear, and honest communication. I think really demonstrating a willingness to share everything that we are learning as public health officials that we want the public to know, and not really holding back or letting our message be influenced by these unspoken factors. And the second thing is excellence. I think the more opportunities that we have to demonstrate the power of public health and our ability to respond to outbreaks and prevent new ones with excellence, the more the public will really see and appreciate that. And I know there are thousands of public health officials all around the country who are doing that day in and day out. And so part of what I wanted to do with Crisis Averted is really highlight those stories. But as we think about rebuilding trust, continuing to return to this idea of demonstrating and sharing excellence, I think is one path back.
And when you prevent something and it doesn't happen, the credit sometimes gets lost, right?
Absolutely. And this comes back to communication for me as well. Historically, there has been a judgment that only kind of large events that we want people to take direct action on when there is an emerging pandemic, for example, it's only been those large events that public health officials really want to talk to the public about. There's some sense that there will be alarm fatigue or that crying wolf, people will hear too many messages and start to tune out. And those are all considerations, certainly. But I think what's lost is these smaller events where there are successes and where we do want people to know that the business of public health is going as planned. And so for me, one of the strategies that we as a community might be wanting to look into and adopt is more of that constant communication, sharing, there's a small foodborne outbreak, we're responding to it. Here's what you need to know. There's an increase of influenza in our community. Here's what we're doing. Here's what you need to know. Those are not 5-alarm fires. They're more like turning on the Weather Channel and hearing today's another sunny, warm day, but those kinds of messages have value as well.
You tell a great example of this in the story of tornado warnings. Could you share a little bit of that?
Absolutely. In the first half of the 20th century, it was actually against the Weather Service's rules to warn of conditions of tornadoes. And the justifications that meteorologists offered for why it was better that they not warn of tornadoes, I think have a lot of resonance with what I hear in the public health community today. Meteorologists said that tornado warnings would create panic, and that was something that should be avoided. They could create a stoppage of business because, of course, people would run to take shelter and abandon their commerce, I guess. And one particularly funny justification was that the shelter that people might seek in damp basements, the health effects would be worse than the tornado itself. And of course, now, fast forwarding here in the 21st century, all of those justifications seem quite flimsy. In fact, it is really one of the primary objectives of the Weather Service to warn the public when there are severe weather events and to inspire them to take action. There's no longer this sense that there should be a hidden set of variables like not wanting to stop businesses that should influence tornado warnings. And so for me, the transformation or the evolution of how weather went from something where there was fear about the kinds of emotions it would create in the public to really embracing the public as a partner is the kind of transformation or the kind of journey that I want to see public health really lean into.
So you talk about a lot of different outbreaks over time. And my question about that is sort of what keeps you up at night?
There's always something new. I think there's some thought or understanding that the pandemic was rare. And of course, a respiratory pandemic at that level is mercifully quite rare. But it's about every 2 years that we have a fairly serious public health event. Right now, what I'm watching is the mpox epidemic in parts of Africa. This is a relative of smallpox, and I talk about the eradication of smallpox in my book. But it's quite a serious outbreak in parts of Africa and requires really aggressive action to bring under control. I'm also carefully watching the H5N1 event here in the United States. The real puzzle piece is human-to-human transmission. Right now, the virus is heavily concentrated in animals, particularly wild birds and dairy cattle, as you mentioned, and it's been spilling over into humans in single jumps. Mostly people who take care of animals, farm workers, for example. In order to become a human pandemic, of course, it would need to spread from person to person, and it doesn't have that capacity right now. And so that's really the thing I'm watching for, is to see whether the virus gains that ability to transmit. And this is something influenza as a virus is known for, changing and adapting. And so it's possible that comes to pass, but it's not the case right now.
So given the current atmosphere where public health is struggling with an image problem, what can we do to change people's thinking about how public health works, aside from, of course, making your book required reading?
Yeah, thanks for that. It's such a difficult moment in public health because the pandemic was so difficult for everyone, for public health professionals, for members of the public, for all of us as we tried to navigate that historic time. And now we're entering a new administration where some of that questioning or skepticism of the value of public health interventions is really coming to the fore. All of this is happening at the same time as social media and traditional media are really disaggregating. And so for me, what all of that comes together into is a need to really spend more time communicating and messaging. It used to be that if you were a public health communicator and you worked with traditional media, for example, you could reach millions of people. Like if you were on CNN, you reached the American public. And it's just not the case anymore because there is so much fragmentation in our media landscape. And so for me, we have to accept that because there's no way around it. And we have to spend more time reaching all of those different individual channels where people are getting their news.
We are seeing a change in the presidential administration. Some have expressed concern about how this might impact public health going forward, and I'm curious your take on that.
I think we'll just have to wait and see. I really see mixed signals here, which makes it difficult for me, at least, to pass judgment at this moment. The incoming presumptive Health and Human Services Secretary, Robert F. Kennedy Jr., is a longtime skeptic of vaccines, and that worries me greatly because, as I've said many times before, vaccines are one of humanity's greatest inventions and one of the most life-saving inventions in history. But at the same time, he and other incoming administration leaders are putting a big emphasis on the need to reverse the trends in chronic illness. More and more Americans are struggling with obesity, heart disease, diabetes. And so I think there's some potential good that could come out of a renewed focus on helping people to be healthier in that way. And so how this all plays out, I think we'll just have to wait and see. But I hope that we as a public health community are really able to take advantage of the opportunities that are presented in the new administration and at the same time resist or find the courage to speak out against policies or interventions that we think are harmful.
Do you think there is going to be sort of, a fear of resisting?
Yes, I think that's very possible, unfortunately, just because we don't know exactly what's going to happen. As an academic scientist, I receive much of my funding from the federal government, and the thought has crossed my mind is that a potential conflict against me, speaking my mind, should I have something that I feel I need to speak against. And so I think that is a fuzzy area or an area of concern for a lot of people. And unfortunately, I don't know yet, how to regard that possibility.
So I asked you earlier what keeps you up at night. As we close this out, what makes you hopeful about public health?
I am hopeful, or at least heartened, that much of the attention paid to public health has been maintained. So during the pandemic, there was a spotlight shined on the work of public health like never before in my lifetime. And I'm really seeing that people are maintaining that interest and awareness. I heard a piece on NPR just recently that was calling attention to the high levels of influenza activity right now. And, we're 5 years post-pandemic now. And so I think the idea that people are still interested in what's happening with flu, for example, with COVID activity, with H5N1 is a positive change. It gives people more tools and more awareness to make good decisions in their lives. And I think that's something that we can really take advantage of in terms of helping people to live healthier lives going forward.
Caitlin Rivers, thanks so much for joining me.
Thanks for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.